Welcome to Newsmakers in the Age of COVID with Public Citizen. I'm Peter Maberduke, Public Citizen's Access to Medicines Director. In this and future forums, we will be discussing key initiatives undertaken, the visions proposed by health leaders worldwide to end this pandemic and build resilience for the future. In a few minutes, we will be joined by Dr. John Kangasang, Director of the Africa Centers for Disease Control and Prevention, and a leading voice in global efforts to ensure that COVID vaccine access is available for everyone, everywhere. Dr. Kangasang just this week hosted an historic conference featuring heads of state and international organizations and culminating in the launch of the Partnership for African Vaccine Manufacturing, which he announced yesterday and will discuss with us, followed by your questions. Dr. Kangasang's vision for the sustainable regional production of essential medical tools is one that we and an increasing number of health experts around the world share. Yesterday, more than 60 major health and development organizations based in the United States wrote President Biden asking him to launch a Warp Speed for the World, a global vaccine manufacturing program coordinated with the World Health Organization and featuring manufacturing hubs on each continent with the urgency, scale, and ambition to meet global COVID vaccine access needs and end the pandemic. Public Citizen law and policy researcher Zain Rizvi joins us now to discuss one way this could be accomplished. Hello, Zain.
Hey, Peter.
Zain, mRNA technologies look especially promising to help produce billions of doses in relatively short order, timely to help end the pandemic, and are adaptable to future needs. Walk us through the plan.
Sure. So mRNA technology really is extremely promising because unlike other ways of manufacturing, it is a largely chemical-based process. So instead of biology, it's more chemistry. And as a result, the production facilities are smaller, they're cheaper, they're easier, and they're faster to set up as well. And so the plan envisions a US government-led effort working with the World Health Organization to establish regional hubs. And the idea is that the US government would not just deploy financial resources, but would also deploy its technical expertise through an agency like BARDA to set up these regional hubs that are capable of producing billions and billions of doses. We know, for example, that in order to produce 8 billion doses of mRNA vaccine, you need approximately 25 production lines. The capital cost for that is around $2 billion. And then the raw materials constitute the large proportion of the cost, which are about $17 billion. And the rest of the money is split between providing technical assistance and providing compensation to the originator corporation. So you're looking at about $25 billion can help produce 8 billion doses of the NIH Moderna vaccine, for example.
Which seems especially worthwhile given that we're expecting trillions of dollars in costs due to delayed global vaccination, and of course, millions of lives on the line. Tell us how you think this connects to the initiative announced by Dr. Kangasang and the capabilities of getting to initially short-term ambitious needs for the pandemic and longer-term manufacturing goals for sustainability for the world.
I think it is about recognizing that the world needs to do everything it can to produce as many doses as possible as quickly as it can, and recognizing that it can't be just a one-off initiative because we don't know, frankly, what if we'll need boosters, if we'll need variant-specific doses. We don't know, and there's so much uncertainty about what COVID-19 will look like in the future. And in addition, we know also that COVID-19 is one pandemic, but there are maybe potentially others, and so we need to really build a public health infrastructure now, when we have the capability, when we have the opportunity, when we have the political will to really do this and do this in a way that could save millions of lives and save trillions of dollars.
The U.S. Secretary of State Blinken will be hosting tomorrow fundraising conference for COVAX, fundraising efforts for COVAX, the Global Vaccine Equity Initiative. How can new manufacturing proposals help COVAX reach its goals? What more why can't COVAX on its own, on current resources, get what the world needs?
COVAX is important, and COVAX has aimed to provide approximately 20% of the population's doses by the end of 2021. But we now understand that that is not enough. The US alone has exceeded in vaccinating more than 20% of its population already. That was on Saturday. COVAX so far has distributed around 39 million doses. The state of California alone has distributed 28 million doses. And so we need a massive effort to really get doses online as quickly as possible. And so we need to manufacture doses, and we need to set up the capabilities so hubs around the world can start producing as soon as possible to end the pandemic.
Thank you very much, Zane. So health efforts around the world underway to set up regional hubs of production and deal with both the short and long-term need. We're going to turn now to hear a very profound vision from Dr. John Kangasang, Director of the Africa Centers for Disease Control and Prevention, which is a public agency of the African Union. He has previously served as Chief of Virology at the World Health Organization and Special Envoy to the Director General during the COVID response. He has authored more than 250 peer-reviewed articles in international journals, and from the beginning of the pandemic has been a leading voice in efforts to end the pandemic and provide vaccine access to everyone everywhere. Dr. Kangasang, welcome.
Thank you, Peter. And let me just recognize Zane for that very important remarks that he just made about vaccine manufacturing. But I would hasten to say that we need to act now, we need to act collectively, and we need to act differently. And let me expand a little bit on all three components of acting now. You said, Peter, clearly that we need to do this with urgency. And I'll take it further and quote Dr. Martin Luther King in 1963, where he talked about the fierce urgency of now. For us in Africa, that phrasing can't be more true than it is today. That Africa as a continent is really at a crossroad of how do we get our population immunized adequately. And Zane gave some very staggering numbers there. I mean, the total number of doses on the continent of Africa is perhaps nothing compared to anything that has happened in a state in the US. So I think that we as a continent of 1.2 billion people, our target is to immunize about 60% of our population by the end of 2022, if we have a fighting chance of eliminating this virus on the continent. But if you look at the current rate of rollout of vaccines, we will struggle with that target for sure. It might be further down the road, except a couple of things happen. First of all is that our partners, friends, the United States, in particular, especially with the leadership that it has exercised over the years, must release some of the doses that they have to the continent immediately. And that will enable us to unlock the jam that we have. The COVAX facility was relying on the AstraZeneca doses from India, from Serum Institute. You all know what the situation is. India has put a ban on those vaccines. So even though COVAX distributed the first round of vaccines, countries are now at a loss as to when the second round of vaccines will come in there. You just yesterday heard the issues with Johnson & Johnson vaccine. And the company itself has put a pause to it. The United States has put a pause to it. That is definitely going to affect us on the continent. So where do we go from here? We really need to begin to thinking differently and acting now, which is why the whole discussion about messenger RNA is so important. At a meeting 2 days ago, President Kagame explicitly talked about the need for the continent to leapfrog this process and begin to explore how messenger RNA capabilities, facilities can be set up on the continent. I think other head of states, President Cyril Ramaphosa from South Africa, President Macky Sall in Senegal, and Tshisekedi all rallied behind that. So I think the moment is now where true partners, what we called yesterday as trusted partnership, and launch the partnership to advance a partnership for Africa's vaccine manufacturing, in abbreviation PAM. It offers a platform for such partnerships and collaboration to solve an issue of our time. This is the issue of our time. This is the problem of our time, and it requires that we exercise true global solidarity through global cooperation and coordination of our efforts. And messenger RNA seems to be a technique that we are looking forward to developing the partnership to leapfrog that with. So I'll just conclude by going back to what Zen said, that yes, it is possible that in the spirit of acting collectively and acting differently, that in such an initiative as you make a call to the White House to think regionally as well, and to say that, yes, there's a role for WHO to play as the global coordinator, but there's also a significant role for regional bodies like the Africa CDC to work more with their head of states regionally to advance such initiatives there so that it can go quickly, it receives the highest political drive, and it can actually be implemented and scale up very, very quickly from the regional perspective. Thank you.
We congratulate you on the launching of the partnerships, truly an historic initiative. Could you tell us a little bit more about how you anticipate the partnership being structured? Who are the key actors? The role of CEPI, for example, was introduced yesterday, the Coalition for Epidemic Preparedness Initiative, the Africa Finance Corporation, with support of several heads of state. I think it would be useful for us to understand where you're at in terms of concretizing the partnership so far.
No, wonderful. I think there's a couple of pillars that surround the partnerships. One is financing. And I hasten to say here that when we refer to financing, we want to change the paradigm and shift it from that financing, meaning that the resources will all come from outside the continent. We know that we need resources, and I'll come back to that later. And that's why partnership, the word partnership is so important, but that you need to rely on indigenous funding. That's why the partnership with the Afri-Exim Bank and the African Finance Corporation was highlighted, the sign. And that's why the partnership with the African Development Bank is so important. In the coming days or weeks, we'll be re-engaging with all of these partners that signed or pledged 2 days ago, the African Development Bank, the Afri-Exim Bank, and others, to look at how do we coordinate this financing component there. Then based on that, we look outside of the continent. We look at financing possibilities with the different options that are on the table, the World Bank and other financing corporation and bilaterals, like what the initiative Zen just discussed with the potentially, if it goes through the White House, how can we do that? So that is one. The second thing is regulatory. Okay, we have to build on the fact that Africa already has on the table the African Medicine Agency to strengthen that very, very quickly and build the right partnerships around it so that it can come to life very, very quickly. Then you have the issues of strengthening research, regional research capabilities and hubs, as we discussed yesterday. I think that is extremely important. What we call it know-how, transfer of know-how, has to be on the table. Then lastly, partnerships. Partnership is really framed to include technology transfer. There's a whole area of partnership. Partnership in the areas of just supporting institutions that we, like the Pasteur Institute in Senegal, what President Kagame offered 2 days ago, really offering Rwanda as a site, what the Pasteur Institute in Morocco is doing, and South Africa. So those are the elements, the ingredients that we are putting on the table to build a partnership. On top of that partnership, on overarching is the Africa CDC with its political muscles, with a link to the African Union. And of course, you heard at the closing, President Tshisekedi explicitly saying, I will oversee the implementation of this partnership. I think that is clearly a strong commitment that we hope we will take this when we frame it and develop a roadmap for it in the next coming weeks, that he can take it to his peers, all 55 head of states, and say, look, this is the plan, the Marshall Plan for us to develop vaccine manufacturing for the continent.
Thank you. You have targeted 60% local vaccine production by 2040. And of course, the concept of regional manufacturing hubs is gaining traction worldwide. One possible concern about the plans that have been put forward is, do we still have the ambition to end this pandemic, not just respond to the long term, but provide an adequate response to get vaccines to everyone who needs them worldwide more quickly than is currently the case. As you know, some have projected that it could take several years. Can you walk us through the timeline, the short, medium, and long-term objectives, and what you think is possible?
Yeah,
what additional tools you might need to get us there? What sort of support globally?
No, absolutely. The number one goal for us now is to get rid of the virus from the continent, period, which will be part of the global work. I don't think that anyone in public health would submit that we can live with this virus, that we can allow this virus to become endemic on the continent. I think that would be a catastrophe for several reasons. We are still learning to understand this virus. Look at what the challenges that we are facing with the variants. Look at the challenges with the vaccines. So I think our number one short-term goal has to still be mobilize resources, mobilize the partnerships to get us over the finish line by the end of 2022. And I remain optimistic that global health powerhouses like the United States will listen to our call for action and work with us as they have done previously in the fight against HIV/AIDS, in the fight against malaria and others on the continent. So I think that is number one goal. And we can do this in two ways. One is, of course, to continue to work with the existing mechanism, the COVAX, the African Vaccine Acquisition Task Team, but also jump into manufacturing. I think you or Peter Riley, you or Zen Riley said, we truly don't know the duration of these vaccines that we are having. So it may require regular boosting there. So that is why it's so important that we bring back the messenger RNA discussion and see where we can start moving that agenda forward, maybe in Senegal, maybe in Rwanda, maybe in South Africa or Morocco. I think that is very important. That will begin to ease the vaccine jam that we currently have on the continent. I think that is one. The second thing is, how do we now step back and say, Africa imports 99% of its vaccines and only produce 1% of the vaccines. How do we change that paradigm in 20 years? Okay, and so that in 20 years, we get to that 60%, we reverse the chart, the pie chart, and move away from in manufacturing 1% of our vaccines to about 60% of our vaccines. I think that will be, in 20 years, is it doable? I think it's absolutely doable because of the new technologies that have emerged and the possibility of doing that. It requires goodwill, it requires commitment, it requires partnership for us to get from 1% production to 60% production in 20 years. I think that is possible. If we do not do that, in 20 years, then we failed ourselves. Then our health security continues to be undermined. I think that is key. And so what do we need to get there? First of all, you need Africa's own capital to be to consider this as part of our health security, as part of our economic security. We have seen the devastating nature of what COVID has done on the continent. We've also seen how easily we are connected as a people in the same planet. We've seen how vulnerable we are as people in the same planet, and we have seen the vast amount of inequity that exists within a country, between countries, and between regions. So I think it is very obvious that we need that we look inward for resources, but also look outward for additional partnerships with the US government, the Europeans, and the Chinese, and the Japanese, and others.
What role do you envision for the World Health Organization in this space? And you referenced the sharing of technology and know-how. How do we encourage or ensure companies that hold that know-how today to share it more broadly with the world, given that they may be counting on future profits from similar technologies?
I fully understand where companies that have developed this technology are coming from with respect to restraining the ability to share their technology. But I also want to be sure that we understand that there's no point having a technology where it will fit into nobody. Okay, look at the devastating nature of this virus. What if, let me caricature a virus that in future can actually be even more devastating. So you have a virus that spreads as fast as COVID. You have a virus that has a case fatality rate like SARS in the SARS, the virus that we saw in 2002, or Ebola with a case fatality rate of 50%. But you also have a virus that is as difficult as HIV to manufacture a vaccine, which means you live with that virus for so many years to come. So the question now becomes, well, you keep the technology, but how are you going to make that profit from such technology if there's no one out there to buy the technology or to buy any of the goods that the world will produce? Look at the disruptive nature of what COVID has done to economies across the world. Completely, I mean, shown us how vulnerable we are, regardless of whether we live in the global north or we live in the global south. So I think in the context of trying to protect our health security, but very importantly, protect our economic security, there's a case to be made there that you're sharing so that the world gets to normality, and then the companies can make more money. But in a world that people are flourishing, ready to spend and ready to move around freely, it will be a sensible case to be made.
Thank you. One more question, and then I think we should turn to the reporters who have joined us today. You were working in Cote d'Ivoire as part of a U.S. Centers for Disease Control and Prevention project on HIV when antiretrovirals first came online. What parallels do you see between the HIV crisis and the COVID-19 pandemic when it comes to access to medicines?
I think I see a frightening parallel with that. In 1996, I was a young public health officer in Cote d'Ivoire, and believe me, I still had hair all over my head, and we saw a situation that was extremely worrying. I mean, I remember my office was overseeing the infectious disease clinic of what they call CHU de Tragedy. And you see that people come in the evening or in the morning, early mornings, and dump their loved ones there, and they were left abandoned to die. Treatment against HIV, the so-called anti-retroviral treatment, became available in 1996. And I remember in the meeting, the conference in Vancouver, everybody was in a very celebratory mood there, because immediately after that, we saw how the mortality rates decreased rapidly in Europe and the United States. But it will take 10 years between 1996 and 2006 before we started seeing the effect of the drugs in Africa, or even access of the drugs to Africa. It will be up to when PEPFAR was launched in 2001, 2002, and the Global Fund that we started seeing Africans benefiting from that. And in between that period, that is over a period of 10 years, about 12 million Africans died. I think that was now add unnecessarily, because we could have done better. Now, the whole issue of generic drugs, intellectual properties and other, those discussions were occurring at that time. And I remember in the meeting, the AIDS conference in Durban, we had we were all marching on the streets in Durban there, asking for access to treatment, access to drugs and others. We don't want to be in that situation. That's why I think on the 24th of December, I started calling for action by saying that we may be heading towards a moral catastrophe if something was not done and done urgently, because history, we don't want history to repeat itself. I don't think that those who write the history of this pandemic will remember us well, that we let millions of people die in Africa or in other developing worlds, whereas the vaccines were held in large quantities in developed countries.
It was a global crisis and a social movement that gave birth to all the work that my colleagues and I have done since, an inspiration that we draw on every day. The power of generic manufacturing, new competitive strategies, and social movements to call for change and make change happen. We're going to turn to reporter questions now. Carmen at Politico, would you like to come in and ask your question of Dr. Kangasang?
Yes, thank you so much for giving me the opportunity to ask a question. I wanted to just ask Dr. Kangasang, you briefly mentioned the developments in Johnson & Johnson. Just before the start of this event, Denmark announced that they will, abandon AstraZeneca. I'm wondering, in terms of also public perception and what this means for this current moment in the pandemic, like, is this a sort of like dangerous moment in the pandemic when, we see this clouds around some of the vaccines? I mean, AstraZeneca is like the main one right now in COVAX, and Johnson & Johnson was supposed to be the next one, and it has the, the advantage of being a single shot. Like, what does this mean for vaccine rollout in Africa, and in terms of perception, in terms of like really being able to have enough vaccines like as soon as possible to immunize people, so we hopefully get out of the pandemic sooner than later? Thank you.
I mean, that is a very good question. I mean, clearly, it makes it extremely complicated for us to strive to achieve our target of immunizing 60% of our population, because there has to be a demand creation where you get people to the community to be confident that the vaccines that they are getting are safe and efficacious. Now, once you start having stories around either the AstraZeneca vaccine or the Johnson & Johnson vaccines, it makes it even more complicated. I think that is very, very, very important. It makes it complicated from building the trust. I mean, the trust capital is so important in the ability to roll out vaccination. Even in ordinary times, I mean, whether you're fighting polio or measles, the community trust is the so-called anti-vaccine movement or the vaccine hesitancy is there. And I must admit that it is very possible that they are winning the war against vaccination in most part of the world, I mean, and including Africa. And the last thing that we want to have is any clouds of doubts around any vaccine in Africa and the world. I mean, it just strengthen that belief that vaccines are not safe on the continent or in the world, for that matter. So I think it is a very it's an evolving story that we are watching carefully. The Africa CDC will be issuing a statement today on that we are watching the situation of Johnson & Johnson very, very carefully. Remember, it's only a few weeks ago that we secured an agreement with Johnson & Johnson to acquire 220 million doses of vaccines, and with an option of obtaining an additional 180 million, just because of what you said. The vaccine is efficacious. The vaccine is a single shot, which you can easily use in a programmatic setting. So it's wait and see. We are really in a roller coaster moment with this pandemic.
Next, I have Sophie with the South African Broadcasting Corporation. Sophie, if you can introduce yourself too, journalists can introduce themselves, that would help.
Thank you. My question, Dr. Kangasang, is as you pointed out that you have placed an order for the continent. What are the options now? Because we have only AstraZeneca and Johnson & Johnson. What are the options now? Because clearly it means in the coming days, we are not going to see vaccinations on the continent. And particularly for the frontline workers, we're talking about the third wave that's imminent. And here we are now paralyzed. What are we going to do? And people are saying on the continent that time has come that we get better leadership during challenging times. Why did we not set up our own structures or our own centers or facilities or capacity to manufacture vaccines? Our scientists on the continent are competing with the best around the world. What is the problem? We have two big economies on the continent, that is Nigeria and South Africa. You can also include Egypt and Morocco. What's the problem?
Sophia, I share your frustration, and I fully understand where you are coming from. Let me just say this, which I've said over and over, that you do not build your health systems when you need them. You build your health system before you need them. I mean, the crude analogy is always that you don't dig your wells when you are thirsty, you dig your wells before you are thirsty. So I think we find ourselves in a situation where we've neglected as a continent investments in our health sector tremendously. We've also neglected research, which is the cornerstone for the development of a people. Let me be very frank with that. There is no nation that I know that develops in the world without investing tremendously in research. So I think that is why, Sophie, as the saying goes, is better to be late than never. So we started the discussion 2 days ago. We raised the discussion at the highest level of manufacturing on the continent. We are receiving very strong political backing from presidents like President Ramaphosa, Kagame, Macky Sall, and a whole host of including the chair of the African Union Commission, Chairperson Faki. So let's see what this movement would lead to. I think I cannot apologize for the past in behalf of the 55 member states, but we have to acknowledge that there has been that negligence in investing in vaccine manufacturing on the continent. Not just vaccine manufacturing, but diagnostics and also therapeutics. So I think if you recall last year, the struggles we were in moving diagnostics until we launched the partnership to accelerate COVID-19 testing, then we started rolling out the diagnostics on the continent. So I think at that time also, no country in Africa was producing diagnostics. Now you have Dakar, South Africa, Morocco producing diagnostics. So it can be done and it will be done. We want to believe that what happened over the last 2 days and the initiative, the PAM initiative, the partnership for Africa's vaccine manufacturing will actually go a long way to catalyze that space so that we can have our own hubs across the 5 regions on the continent in a stepwise manner that will resolve this problem for once and for all. And I wish to see that happen in my lifetime. So I think that is that. With respect to where do we go from here with the vaccines, with the AstraZeneca and Johnson & Johnson, we are not yet giving up hopes for those. We will be issuing a statement, as I said, this evening, cautioning the continent and giving some advice that we are monitoring the situation and we'll be able to issue very specific guidance in the coming days once we know more about what happened with the Johnson & Johnson situation in the US. We now know that out of about 6.6 million vaccinations with the Johnson & Johnson vaccine, 6 people developed blood clot, and the FDA and US CDC are investigating that. We are in touch with them. We are also in touch with the government of South Africa. So we really remain optimistic that we'll have some more clarity in the coming days, and then we can see provide appropriate guidance on where we should be going.
Thank you, Dr. John. I have Jimmy Manan with Voice of America, I believe.
Hi, can you hear me?
We can hear you.
Great. Okay. My name is Jimmy Manan, and I'm international broadcaster with Voice of America in Washington. And I like to direct my question to Zain Rizvi, if it's possible.
It's possible. He's here with us. He's ready.
Great. So you briefly explained what looks like a new initiative, which I'm totally unaware of. Can you please expand more on this initiative? Is this a new source of production and distribution? And is this aim to least developed countries to counter the imbalance of vaccine distribution currently?
Yeah, so I should clarify that this is a plan, this is a proposal that Public Citizen has put out, and we hope it becomes an initiative very soon. And it would certainly help address some of the imbalances that Dr. John has so eloquently described. And I think, just on this point, it's worth mentioning that there have been initiatives like this in the past. And so we are proposing a new plan in a way, but it's also building on other plans. And so, for example, the US government in 2006, the world was very afraid of bird flu and what bird flu might look like. And so the US government, working with the World Health Organization, launched a program to help build pandemic flu manufacturing capacity. That program lasted 10 years, and it significantly increased pandemic flu vaccine manufacturing capacity in, I believe, 13 countries. And so we are building on the lessons of the past, and we have significant advantages now as well, because we understand that some of the newer technologies, mRNA in particular, really do hold promise for their scalability and for their ease of manufacturing. And so we are optimistic, and we are continuing to advocate that the Biden administration should launch an ambitious global manufacturing program. We think the Biden administration should go big and they should go fast, because this is a once-in-a-century crisis, and we need the US to really step up.
And Jimmy, just to supplement what Zain has said, yesterday, 65 plus health and development organizations in the United States put out a letter calling on President Biden to launch such a manufacturing program for the world, and we can make that available to you. Dr. Kangasang, if you have any follow-up on that, we're very happy to hear it. I'd also like to invite journalists to raise your hand and ask more questions. Dr. Kangasang, I've got one or two other questions for you as well while folks get their thoughts together, if that works. The African Union has endorsed the TRIPS waiver, the suspension of intellectual property rules at the World Trade Organization for the duration of the pandemic. What do you see as the benefits of the arguments for that waiver?
I think the benefits are aligned with what Zain just talked about. And if we have to expand regional manufacturing capabilities, such TRIPS suspension will help. I mean, definitely help. And if we have to build regional hubs for research and development, that will help. If we have to support transfer of technology and to support local companies in Africa, incentivize that will help. So I think it's what I call, I'll put that in the pocket of what I characterized earlier as acting collectively, but differently. I mean, we have to do it. I mean, we cannot use the same solutions that we have been using over and over in fighting endemic diseases, in fighting this catastrophic pandemic. I mean, it will just take us decades to get there. So I think it's something that the African Union has tabled in the Executive Council of the African Union, endorsed it, and I believe the Assembly of the Head of States as well.
Very good, thank you. We have a question regarding from Jyotsna Singh. Jyotsna, I'm not sure if you are able to, I'm not sure if she can ask herself, but a reporter from India who's mentioned that Cuba has some promising vaccine candidates and is wondering if we can expect any partnerships between African nations and Cuba.
Oh, we're absolutely looking forward to any partnership that will be that will advance the space. Now, yesterday we made sure that it was very clear that we had certain underpinnings that included clearly trusted partnerships. I mean, that we should be able to align with the vision of the continent. I think one thing is very clear. We are in a crisis and we don't know where all the solutions will come from. So if Cuba has an effective vaccine, or India or China, Russia, we'll all take a look at that vaccine very closely. But we ask for total transparency, total trust in moving that agenda forward.
Okay, and one more question from Sophie McKenna at the South African Broadcasting Corporation.
You spoke about partnerships, Dr. Kangasang. We know that China, a friend of Africa, is manufacturing a vaccine. We saw countries such as Zimbabwe taking up offers. We have Russia as well with Sputnik, and they have also made doses available for certain countries on the continent and other continents, particularly South America. Why are we not taking the offer from the Russians and the Chinese in terms of approving their vaccines so that we have a backup? Because clearly the Western pharmaceutical companies and manufacturers, we have challenges, particularly on these clauses that they have. For example, disclosure clause. South Africa now having to agree to the terms and conditions, whether when you buy, you can't get a refund. Why don't we look to our friends, South, BRICS?
We are. The short answer, Sophie, to that is that we are. And we have been doing that ever since as part of the AVAC, the African Vaccine Acquisition Task Team. Let me just tell you where we are with that. With the Russians, we have the Sputnik vaccine. We have a task force that has been put in place at the Africa CDC, working with the AU NEPAD to review the dossiers of that. And we've actually now sent it to regulatory bodies in Africa to look at that and advise us. And if the advice comes out right, then we'll be more than happy to issue our recommendation for that vaccine. We have also approached the two Chinese manufacturers, Sinopharm and Sinovac, and say, look, engage with us, share with us all the dossiers so that we look at the two key elements, safety and efficacy. And we are still waiting and hoping that they would get to us with that. Remember, none of those vaccines, i.e. the Sinopharm, the Sinovac and the Russian Sputnik vaccines have been provided with emergency authorization use by the WHO. So it's very difficult for us to make a recommendation to you as citizens of the continent, which is not based on a sound approval process. I mean, you'll be the first person to ask me the question that Dr. Kangasang tell us on what basis you approve the vaccines for use. I mean, so we've entrusted that responsibility in the hands of WHO to review that. We hope and believe that both the Russian vaccine and the two Chinese vaccines will go through that process as quickly as possible so that we can advise our citizens to begin to use that vaccine. I don't know if I answer your question.
Thank you, Dr. John. We've got Carmen at Politico and Jimmy at Voice of America each have a follow-up. Let's take both your questions at once if we can and get Dr. John's answer. And I'll have one final question before we wrap because we're coming up on time. So Carmen?
Thank you. It's really connected. And I think you probably mostly answered my question, Dr. Kangasang, about the Chinese and Russian vaccine that indeed they have not yet received an emergency use listing from the WHO. And, there's been quite a few headlines over the past few days about the efficacy of the Chinese vaccines. And I wanted to ask you, so you will definitely wait for them to receive or not a WHO emergency use listing before, recommending them for use in the African Union? Because I think there was there an agreement between the African Union and the Sputnik producers for quite a few million doses that would go to Africa?
Absolutely. I mean, I said there are three scenarios that we use that we've established and guidance that we've established in accessing vaccines on the continent. Scenario one is that the vaccine receives a WHO emergency use authorization. So we also, as a continent, provide a stamp of approval to it or a recommendation to it. Second scenario is that it goes through a recognized national regulatory agency like the FDA, the European Medicine Agency, and others. We also follow through, and that's what we did with the Johnson & Johnson. Once the FDA cleared that, we didn't wait for WHO. We went ahead and also approved that as the Africa CDC on behalf of the continent. And then the third scenario is that the vaccine doesn't meet scenario 1 and 2, and that is where we are with the Russian vaccine. But having said that, we have signed a confidential agreement with the Sputnik producers of the Sputnik vaccine. We are reviewing it. If you also recall, we have a task force that was put in place to facilitate that. So we can actually put our own stamp of approval as the African Union, Africa CDC on those vaccines, even before they get approval from the WHO. But what I'm saying is that besides the Sputnik vaccine, we do not have dossiers for the other two vaccines from China. So it puts us in a very difficult position to advise the continent on what to do. even though member states are independently, of course, they are sovereign, they are independently engaging and using those vaccines. We are not saying that the vaccines are not efficacious or that the vaccines are not safe. We are saying that we have not received the dossiers and reviewed them properly to stand on grounds that we can, if challenged by our own citizens, say this is the scientific basis on how and why we approve the vaccine, which is very important as we are now seeing many things unfolding on the continent. We are beginning to see some newspaper articles published, I think more recently, that the head of the China CDC expressed concerns on the efficacy of the vaccines. That I don't know how valid that reporting is. I've read the same stories you have read, but I would not count much on that. I would just count on direct dealings with the Chinese and Russian companies.
Thank you. Final reporter question to Jimmy at Voice of America. Sorry, I may have just muted you, Jimmy. Can we unmute Jimmy?
Okay.
There we go. We hear you.
You can hear me? Okay, great. Dr. Kangasang, from my last interview with Dr. Paul Offit from Children's Hospital in Philadelphia, he reminds me of very stark statistics that from 194 countries in the world, 130 does not have a vaccination program. Can you give me the statistic of African countries? How many have already up and running vaccination programs right now? And also we can see that the European Union got some hiccups in starting their vaccination program recently. They start up and running now throughout the continent, but they were also faced with all these hindrances and difficulties. Do you also see that the African Union is facing the same problems as your counterpart in the European Union?
Very good question. I think you asked for stats on the continent. Let me share this with you. So on average, you have 1.01 vaccine dose administered per 100 people in Africa. Compare that with 7.86 vaccine doses administered in India per 100 people. And then also compare that with Israel, which is about 118 in Israel. So I think you can see where Africa is with respect to the vaccination program. There are clearly about 23 million doses of vaccines that have been administered on the continent, which is, as I think Jen said, very limited compared to even a state in the United States. Now, if Africa had the vaccines like the AstraZeneca, Johnson & Johnson, and others, would they be able to roll that out quickly? I think the answer is yes. We'll be able to roll out if properly supported and engaged. Ethiopia, in the middle of this pandemic, was able to vaccinate 12 million children with measles vaccines in the middle of this pandemic, given all the challenges. 12 million measles vaccinations there. So if we do that, if countries are able to do that, then we can truly meet our target of vaccinating at least 60% of our population by the end of 2022. So the point I'm making is that African countries have the experience in rolling out vaccination because we do a lot of we use a lot of vaccines on the continent. So we may not, and we may, just as we may, underlining that not necessarily be in the situation where Europe found itself, but we have to have the vaccines. I mean, I always say that, and Sophia say this over and over, that vaccines plus vaccination equals life saved and economic saved. So that is one thing to know how to do the vaccination. There's one thing to have the vaccines. If we have the vaccines, we have to roll it over And I'm very, very convinced that African countries will be able to do that. Rwanda got its vaccines, and within weeks or so, they were able to roll them out as quickly as possible. Morocco is doing a great job in rolling out vaccination. So I think there's many Seychelles and Mauritius, they are rolling out their vaccinations in a remarkable way. So there are many good examples that we can point to. Kenya, I think, have exhausted their first shipment of vaccines. So I don't think vaccination itself, if well supported, I want to really be sure that I don't create any confusion here. You still need to create vaccination centers, recruit large number of vaccinators to do that. But if that is done, Africa will be able to roll out vaccination very, very quickly.
And to that point, Dr. Kangasang, there is, in addition to rollout capabilities, there are manufacturing capabilities on the continent, and certainly a number of manufacturers and efforts that are prepared to work on more advanced technologies. We fear that there's a common misconception that's not the case. Would you care to talk with us a little bit about some of the capabilities on the continent today and some of the partners that are working to advance manufacturing projects today?
No, absolutely. There are about 6 countries in Africa that have the ability to, that are already manufacturing vaccines, not necessarily COVID vaccines. I mean, let me start from the West Coast in Senegal. In the Pasteur Institute in Senegal manufactures yellow fever vaccines. So what does that mean? It means that they know how vaccines should be manufactured is there. I mean, that is just clear. You are not, we were to set up a messenger RNA manufacturing in Senegal, you not start from zero. You start from a group of people who understand the rigor of manufacturing vaccines. Then you go to South Africa. South Africa has, 2 sites, Timbalvac and the Aspen group that are very capable of manufacturing vaccines. And then you hop from there up north. Egypt, Morocco, Tunisia all have vaccine manufacturing capabilities of different types of vaccines, including yellow fever, cholera, and others. So those vaccines, and we might be missing some. Then below that is a whole range of countries that are manufacturing animal vaccines, which if you can do an animal vaccine, then you really can easily, if supported, scale that up or repurpose that to manufacturing human vaccines. I mean, let it be very clear. We also recognize that the whole vaccine manufacturing is integrated. That is, the materials and different elements, the supplies come from all over the world, and you need to bring all those supplies together to get them into somebody's arm. But again, it doesn't undermine the fact that there are capable facilities across the continent that can manufacture vaccines if appropriately supported. That is why the partnership for African vaccine manufacturing is so timely and is so important. It requires coordination so that not all countries need to be manufacturing vaccines, but if Africa CDC, as part of the African Union, is at the center coordinating and bringing in the right partnerships there, then you really create efficiencies, and then you can actually fast track that process and take advantage of the momentum, the political momentum. If today we took a flight to Kigali and sat with President Kagame, he would tell you that if you need anything, let me know and let's get started there. So that's the kind of strong political leadership that it has already occurred on the continent, and we need to ride on that political capital to advance the agenda.
Thank you so much, Dr. John. Dr. John Kangasang, head of the Africa CDC, who just this week hosted an historic conference on African vaccine manufacturing, culminating in the launch of the Partnership for African Vaccine Manufacturing. We congratulate you on your accomplishment, and we are with you in this fight. Clearly, it falls to all of us in civil society, faith leaders, people around the world, to raise our voices to our political leaders and mirror Dr. John's clarion call for manufacturing and capabilities that can put an end to the pandemic, put an end to the vaccine apartheid that is blocking so many people's access today. Thanks for your time, and we will see you next time.
Thank you.